Alright, welcome back to O.M.A Medical today. Today we are going to have a discussion on pelvic inflammatory disease. I think this is something that has been disturbing a lot of people, especially the female gender. So basically, we are going to get to know some small details of it, and in our subsequent ones, we'll basically talk about how to go about the management. But for today, we are talking about how it comes about and then what we should be looking out for when any of these things should occur. Alright, so today I'm going to sit down to start explaining something. Alright, so as you can see on the board, this is our key guide here. What we see on the board from the top there, that's going to be our key guide to this discussion. So we are going to take them one after the other and then discuss them to more details for everyone to understand. Per this particular discussion, um, at a point in time it's going to get a little bit where if you are not health inclined and you are not following well, you are going to get confused. But I'm not sure this is going to get a lot of people confused because it's going to be very simple. Alright, so when you look on the board, we have what and we have our key guide. That's the key notes here. We need to take as a guide. We have definition, we have risk factors and causes, we have presentations, and then misleading factors. I mean, there's a story here because there's going to be something you're going to talk about there. Then we talk about the complications. One of the things we will jump in this particular discussion is this, the treatment. We are not going to talk about the treatment or the management. We are not going to talk about it in this particular discussion. Maybe subsequent one we will talk. Definitely we need to talk about it, but not in this one. Alright, so pelvic inflammatory disease, commonly and simply known as PID, and I'm sure a lot of us might have heard about it or probably experienced it before, but maybe we just didn't know how it comes about, or probably we just heard it from our doctors and nurses, and then yes, we just heard it that way. So today, take this opportunity to get to have an idea about it, so you know how to go about your life. Okay, so in simple terms, I put this as basically STIs in females. Yes, so pelvic inflammatory disease is basically STIs in females. That's how I'm going to put it, right? With the kind of the male symptoms, the other gender, sometimes you can specify them, say this is gonorrhea, this is that. But for females, I'll put it together as well. Pelvic inflammatory disease. Alright, so what is pelvic inflammatory disease? Let's deal with the first point, that's the definition. Let's deal with this one. When you say pelvic inflammatory disease, it basically means it can be acute, it can be subclinical. It means it can give you symptoms, very obvious symptoms, and then it can go hiding within you. There is an acute or subclinical infection of what? The upper female genital tract. When you look at the female genital tract or any genital tract at all, we basically have the lower and the upper. Now, when you take the female reproductive organ, we have the lower side, the lower parts of it, and the upper part of it. Now, to know that, we basically use the cervix. The cervix here. So anything below the cervix is basically, when you take the tract, anything below the cervix is basically the lower genital tract. Anything above the cervix is basically what? The upper female genital tract. So when you come to the lower side of the cervix, we basically have the vagina, the vulva, the vagina. The vulva basically includes the clitoris, the labia majora, and then the minora. Then we have what? The vagina. And that is the what? Lower genital tract of the female reproductive organ. Then we come to the upper, which we have the opening of the uterus. That's basically the cervix, the opening of the uterus, and then we have the uterus itself, we have the fallopian tubes, and then what? The ovaries. These are the structures that make up the upper female genital tract, and these are the structures that make up the lower female genital tract. And we are saying that PID or pelvic inflammatory disease is what? An infection of the what? Upper female genital tract. As simple as that. Now, what causes this infection? That's the second thing we are looking at. What causes this infection? What are some of the risk factors? I mean, first of all, one thing I'll pass out, like I said earlier on, I'll term this pelvic inflammatory disease or PID as what? STIs in females. or sexually transmitted diseases in females. Now, when you come to the causes, almost 80% or 85% of the cases of people with PID, almost or more than 80% of it is caused by sexually transmitted pathogens, STI pathogens. When you say pathogens, pathogens are disease causing agents. So organisms that causes diseases, they are pathogens. And they are saying that PID is basically caused by pathogens that causes STIs. What are those pathogens? Mainly, we have the Neisseria. That's the organism responsible for gonorrhea. So Neisseria gonorrhea. And we have what? Chlamydia. That's another stubborn STI as well. Chlamydia trachomatis. Then last that's last of the major, we have Mycoplasma genitalium. So these are the three major pathogens for STIs in this particular situation. So anyone that has pelvic inflammatory diseases, if you are thinking of managing it, then basically you need to think about tackling these three agents. You are thinking of managing pelvic inflammatory disease effectively, then you should think about eliminating these three stubborn agents here: Neisseria, Chlamydia, Mycoplasma genitalium. Alright, so these are the causes. What are some of the risk factors? Risk factors to this is basically the first and foremost risk factor is basically you being a female to this pelvic inflammatory disease. You have to be a female to get this, right? Then two, when you have already suffered from PID before. So people who have already suffered from PID before also stand the risk of what? Contracting another one or getting reinfected. Then three, having unprotected what? Sexual intercourse with an infected person. I mean, it could be a female, like I said, it's basically what? An STI in female. So if a male has an STI, if a guy has an STI and it gets into you, basically you're also going to, this is your portion of it. The gonorrhea, the chlamydia, this is your portion of it. You understand? So if you get into contact with someone or a male that has STI which has not been treated or which has not even been treated, you also stand a risk of what? Contracting these organisms and eventually suffering from what? Getting infected with what? Pelvic inflammatory disease. So these are the three basic organisms that can. I mean, we have other organisms like the E. coli is also causing about 15% of the conditions when it comes to pelvic inflammatory disease, the group A stress. I don't want to get into that level. I mean, if you decide to get there, probably we are going to talk about a lot of things. Alright, so those are the risk factors. Then we basically have people who undergo like I was saying earlier, the cervix is actually the gate to the uterus, and once you get into the uterus, you basically have gotten through the upper genital tract of the female. So if you have any infection here, any infectious agent here, the cervix is supposed to more like protect the entry of those pathogens or those disease causing agents at the lower side from getting into the upper side. Now, when there is a manipulation to this, when you tamper with the state of the cervix, especially those who undergo EOUs, evacuation of the uterus, probably want to just terminate your pregnancy, and then per any means you want to get rid of the pregnancy. Eventually, you are going to tamper with the state of the cervix, which allows infectious agents at the lower side to swim to the upper side of the tract, and at the end of the day, getting in contact with these things. Once they get there, they begin to cause havoc, and then you subsequently end up suffering from what? Pelvic inflammatory disease. Alright, so those are the risk factors and the causes. Then we go to presentation. How do they present? Those are the things. How do they present? So these are some of the symptoms you are going to suffer when you get infected with pelvic inflammatory disease. Majorly, the key things here, let me put things here. The key things here you are looking at when you get infected with this first three things that actually will come in my mind is basically what? Lower abdominal pains at the pelvic region, lower abdominal pains. Have lower abdominal pains. Then we get to what we call cervical motion tenderness. Then we get to painful sexual intercourse. Yeah. These three things will eventually be there. Alright, so the common ones you will basically see lower abdominal pains, painful sexual intercourse. When you're having sex, you feel pain. You understand? So if you are basically someone, let's get through all the sentences you come to understand. So these three, then you can have what? Vaginal discharges as well. Then you can also have um, intermenstrual bleeding, abnormal. Then we can also have high levels of bleeding. I mean, you are supposed to have your menses for some number of days, and basically maybe you had your menses, it's supposed to last for like 6 days. Now this one is lasting more than 6 days, or probably when you have your menses, it change about 2 parts a day. But basically, this time it has changed. You are changing about 4 parts a day. Understand? So there is high levels of bleeding. That's menorrhagia. Forget the terms. Just keep the explanation in your head. Yes, you get through with these ones. Lower abdominal pains, painful sex, vaginal discharges, intermenstrual bleeding, and then what? Menorrhagia. Then what you call the cervical motion tenderness. Most of the time when you go to hospital and then doctors suspect pelvic inflammatory disease, one of the commonest examination that is being done is that they will do what you call vaginal examination, put the finger in the vagina, through your vagina, and then try to examine the structures over there. The moment the finger touches the cervix, there is going to be a rejection. There's going to be pain. You're going to feel some kind of pain, which gives this, which proves this particular thing is cervical motion of tenderness or cervical excitation of tenderness. So all these things you can suffer from it. Another thing, now when you are in the setting of these things, most of the time about 10% of the situations, there is what we call the misleading factor I place asterisk on. There's what we call fit what's the name of it? Fit syndrome. That's perihepatitis around the liver. I mean, when you say hepatitis, basically inflammation of the liver. But this particular hepatitis is just affecting the surroundings of the liver, which we call the liver capsule. So basically, it's not the 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 condition or the effect is actually not affecting the liver tissue itself, but then the cover around it. So when it affects it, this is what you suffer from. Now it's going to give you pain. So in the setting of PID, going through all of these things, you can have pains at where the liver is. The liver is at your upper quadrant here. So the person might suffer pain from there, and probably if you don't examine this person well and then consider these situations, you probably be thinking outside the box. You basically think the person doesn't have this, but it will mislead you to think the person has maybe hepatobiliary disorders where you have the cholecystitis, cholangitis, and so on and so forth. You understand? So just know that in the setting of this, about 10% of the situations, people suffer from this thing, Pitt-Hepatitis syndrome, which is what hepatitis. So it takes time. There are some things you are going to see just related to the liver capsule. The liver parenchyma or the liver tissue itself will be intact, and the person is basically going to come with pain and tenderness at the right upper quadrant area. So just take note of that. All right. So you go through. There are more symptoms to this thing. Sometimes you can go to the point where they can even give you that kind of feeling when you are urinating, feel some kind of lower abdominal pain when you are urinating and all of that. So these are some of the common symptoms you see. There could be discharges, there could be intermenstrual bleeding, there could be menorrhagia, painful sex, lower abdominal bleeding. Like these are the main three I want you to keep in mind. You have lower abdominal pains, you have painful sex. This one you are not going to see. Someone has to be, but then just know the painful sex, lower abdominal bleeding, and probably what vaginal what discharges. And sometimes when you are having abnormal menstrual cycles, you should also take note of it. Consider to have some of these things so that you end up you going to the hospital for further investigations to be done. All right. In situations in these settings too, normally when you take your, I mean, if you're a clinician, the patient comes to you, you are highly suspecting pelvic inflammatory disease, and you basically wouldn't see anything in the FBC, the full blood count. Maybe if you are suspecting to see raise in white blood cells, it might come out to be normal. You understand? So diagnosing this is basically um, clinical. Yes, the practical side of it is just clinical. It should be clinically diagnosed. Otherwise, if you are going to base on your labs and things, you're basically going to lose or misdiagnose the person. Alright, so that is just by the way. So I've spoken about the misleading factors, such as the perihepatitis, the complications of this. The most annoying part of this, I think, for all the conversations, it has been around the acute, where you obviously see the symptoms. When you get to the subclinical side, when you are suffering from subclinical PID, yes, subclinical, it means that clinical means basically you will see it will be obvious, but with the subclinical, below the clinical side, when you say sub below, it means you are not obviously going to see symptoms. The people might harbor the conditions, might harbor the infections, might harbor the agents, but they are not going to show symptoms. And that's the most dangerous part of it. But these people might harbor it for several years, and then they might be fighting what we call um, infertility. They may be associating it with all kinds of things. I mean, there was this particular research done about 112 patients were taken. I said 12 patients, 12 112 sample size of people were taken. People with issues of infertility were taken, and then at the end of the study, it was realized that 30 people had PID in association with their infertility issues. So it was just like having infertility issues, which is as a result of a PID. And then out of these 30 people, about 10, only 10 of them were just having histories of PID documented. It means that even if you go to hospital, you might probably not get the diagnosis right, or basically you will not go to hospital because you are not seeing symptoms, or you go to pharmacies, you go to drugstores to buy all your medicine, self medicate and all of that. Those things, the risk of you or the person not following up on you is very high, because you go and buy the medications, you come and take. The moment the symptoms subside, then you think you are okay. Sometimes, most of the time, we don't even complete the medications. You understand? So it leaves room for subclinical situations to set in, and at the end of the day, these are going to mess you up. So one of the complications to PID is what? Infertility. That's one of the complications. Infertility. Reoccurrence is also another issue you need to deal with. Or probably resistance to medications, especially when you are not treating it well. When you start experiencing the symptoms, you go to maybe a drugstore, you self-medicate, the symptoms subside, you stop. You are not killing the agents. You are not doing anything to the agents. You are just also. So they take some more, they become a bit sick, then they don't react and then show you the powers they have like previously. So you think you're okay, then you go back to the same thing. Now, this is another scenario too. Well, we will get to the management side, which I said we are not going to talk about it today, but then if we are able to get through with all of this, we're able to get the diagnosis right, we do every treatment right, where is the room for reoccurrence? You understand? Why does it have to reoccur? I mean, we've been able to treat it, or we've treated it per the number of days we are supposed to. Why does it have to reoccur? So that is what we are going to talk about in a subsequent, when we are tackling the treatment. At the point where you have treated everything, then you still stand a chance of what reoccurrence. Why? We will talk about that. So this is actually an important thing, and I hope everyone followed this O.M.A medical studio. So if you haven't subscribed to the channel, do also subscribe for us. So in order to support us, the only way to support me here telling you all of these plenty things is you subscribing and then trying to send to another person to also watch and what subscribe. And I'm not sure after watching this you not find the interest in what subscribing. All right, so we'll get back to this again. Stay tuned.